Hello everyone, welcome to Sam Science View channel. In today's video, we are going to listen to a science fact about acidity in stomach. Before going to the video, please watch this entire video, and if you have any science related queries, you can ask about it and get it rectified through this channel. Now let's get into the video. What is this acidity? Acidity is a medical condition that is caused due to excess production of acid, which is produced by the glands of stomach. Acidity causes signs such as ulcers in the stomach, gastric inflammation, heartburn, and dyspepsia. It is usually caused due to several factors such as irregular eating patterns, lack of physical sports or activities, alcohol consumption, smoking, stress, fat diets, and poor eating habits. People are more prone to developing acidity in places where people consume more non vegetarian, spicy, and oily food. A lot of medications, such as non steroidal anti inflammatory drugs, can also make an individual more susceptible to developing gastric acidity. Acidity is characterized by a deep burning sensation after consuming a heavy meal. Indigestion and constipation are also common in people who have acidity. It can be cured by home remedies or by consuming antacids and implementing healthy. A technique is known as endosperm also provides immense relief from acid reflux. Common signs of acidity include indigestion, nausea, sore taste in the mouth, constipation, restlessness, and burning sensation in the stomach and throat. What this acidity does to your body? Acidity or acidosis leads to the imbalance of pH in the body. It usually happens when the kidney and lungs are unable to remove excess acid in the body. This does then lead to acidity. Now, what causes this acidity? Our stomach usually produces gastric acids which help in digestion. The corrosive effects of these acids are balanced by the production of prostaglandins and natural biocarbonates which are secreted in the mucous lining. This damages the stomach lining and causes acidity. Other factors which cause acidity include consuming non vegetarians and spicy foods, excessive stress, consuming too much alcohol, smoking frequently, stomach disorders such as stomach tumors, gastroesophageal reflux disease, and peptic ulcers, medications such as non steroidal anti inflammatory drugs. How does this acidity occur in the stomach? Acidity occurs when the gastric glands in the stomach produce an overabundance of acid and the kidneys cannot get rid of it. It usually comes with heartburn, reflux, indigestion. Typically, acidity is caused by consuming extra spicy food, coffee, overeating, having a low fiber diet. Who is prone to this acidity? People who are prone to acidity are overeat heavy meals, obesity, snacking close to bedtime, consume too much coffee. Can this acidity go away on its own? Acidity, commonly referred to as acid reflux, is a condition accompanied by the movement of gastric acid back into the esophagus. The occurrence of acidity is quite normal if it happens occasionally, but it is a serious concern if the frequency is high. Acidity can be a chronic condition, and in that case, it doesn't go away on its own. Consultation with a doctor becomes necessary for early treatment, otherwise, it may lead to complications such as ulcers, strictures, and inflammation in the esophagus. What causes too much acid in your body? Acidity is of two types. One, respiratory acidosis, which happens when there is extra carbon dioxide in the body. It is caused by chronic airway conditions like asthma, injury to the chest, obesity, sedative, overuse of alcohol, muscle weakness, deformed chest structure. Second is metabolic acidosis, which occurs when the kidney is unable to remove excess acid in the body and is too much lactic acid in the body. What is the difference between acidity and gas? Acidity is the condition in which the body produces more than the required amount of acid for digestion. This acidity is usually accompanied by heartburn, while gas is produced in the colon and it aids in digestion. An average person releases gas about 20 times a day either through rectum or mouth. However, when the excess gas is produced or trapped because of eating large meals or spicy food, it is released through a burp. It can mild to extreme and sometimes cause stomach pain if it is trapped or when the digestive system is not running smoothly. What are the early symptoms of this acidity? The heartburn, which is the burning pain or discomfort that may move from the stomach to the abdomen, chest, or even up to the throat. Regurgitation, which is a bitter or sour tasting acid, will back into the throat or mouth that eventually makes sores in the spots. Stomach bloating, hematemesis, bloody or black tarry stool, frequent burps, difficulty in swallowing, continuous hiccups, nausea, vomiting, feeling fullness always, chronic sore throat, persistent dry cough, restlessness, indigestion, and unexpected weight loss. What are the standard acidity precautions? One can follow a number of methods to prevent this acidity, and they are quite simple to follow. You can avoid foods causing reflux. Do not eat more spicy foods, coffee, carbonated beverages, acidic and fatty foods. Split your meal. Do not stick to 3 times regular meal. Split it into 5 smaller portions so that the pressure and reflux can be avoided. Do not lie down after eating. Take at least 2 hours to reach your bed after eating because the food will be back flown into the esophagus. Try to eliminate acidity triggering foods for some weeks. Examine and reintroduce. Lose weight. Excessive fat pressures the abdomen region, thus pushing gastric juice into the esophagus. So try to reduce weight if you are overweight. Avoid certain medicines like some OTC medicines like ibuprofen, paracetamol, which may induce acidity, and other prescription medicines such as anticholinergics, dopamine-like drugs, theophylline, sedatives, calcium channel blockers, and beta blocker do develop this acidity. Try to wear loose cloths around the waist and stomach region as it could reduce the tension around the areas. Should I go to urgent care for acidity? The acid reflux is accompanied by discomfort in the stomach as a result of rich or spicy food or a large meal. Acidity can usually be calmed by over-the-counter medicines like an antacid. But one should go to urgent care if he or she experiences breathing difficulties, persistent difficulties in swallowing, choking, the passage of black tarry stool, weakness, or loss of weight. When should you see a gastroenterologist for acid reflux? Though acid reflux is common in all, do visit a gastroenterologist if the symptom is recurrent. This potential condition will not disappear on its own. Untreated acid reflux will lead to esophageal inflammation, ulcers, and cancer too. Immediately consult a gastroenterologist if you feel persistent symptoms for more than 2 weeks, decreased appetite, heartburn with nausea and vomiting, unable to swallow, chronic hoarseness and wheezing, nighttime symptoms that affect sleep quality. During your visit, the doctor will examine esophagus, stomach, duodenum to determine the cause and will provide you the appropriate treatment. How this acidity is diagnosed? It can be diagnosed in various ways. First is pH monitoring, which checks out the acid level in the esophagus. A device is inserted into the esophagus by the doctor, which is left there for 2 days to measure the amount of acid in the esophagus. Second is barium swallow, which helps to trace out the narrowed esophagus and ulcers. A solution has to be followed and then an X-ray will be taken. And finally, endoscopy, which is a long flexible lighted tube with a tiny camera at the bottom, is inserted through the mouth, and with the help of the camera, esophagus stomach issues are checked out. It is done with the help of sedation or anesthesia. Most effective treatment is the acidity can be cured by consuming antacids that contain aluminum, calcium, or magnesium. Many times, H2 receptor blockers, that is, histamine blocking agents like nisatidine, famotidine, ranitidine, and cimetidine are used. Proton pump inhibitors are also prescribed by the doctors if you have severe acidity. Acidity can also be treated by home remedies such as consuming bananas, cold milk, aniseeds, cumin, cardamom, cloves, mint leaves, and ginger. You can also prevent acidity by avoiding spicy foods or pickles during meals, eating more vegetables and fruits, not consuming non-vegetarian food, avoiding medications such as non-steroidal anti-inflammatory drugs and steroids, and reducing stress. Sometimes acidity can also be caused by consuming food just before sleeping. This provokes the stomach enzymes to flow back to your esophagus and cause acid reflux. This can be extremely detrimental to health. It has been found that vitamin C from fruits and vegetables supplements help to relieve acidity and its symptoms. Vitamin C helps the body absorb iron, aids in digestion, and promotes healthy gums and teeth. Acidity is not a serious concern in most cases, which can usually be calmed by over-the-counter medicines. But there are certain conditions that need to be treated under consultation with doctors, such as occurrence of symptoms for longer duration than expected, persistent heartburns in spite of medications, change in frequency or intensity of acid reflux, poor sleep quality due to nighttime symptoms, acid reflux that interferes with your daily activities or affect your quality of life, weight loss or decreased appetite, difficulty in swallowing, nausea or vomiting accompanying heartburn, hoarseness of voice or wheezing. Many patients usually do not require treatment, as most of the cases are associated with normal symptoms such as discomfort in the stomach. Mild discomfort is amenable to treatment by over-the-counter medications such as antacids. Lifestyle modifications also led to the resolution of symptoms. In other words, there is no need for a doctor's consultation. Treatment in case of acid reflux is followed by some post-treatment guidelines, which are like avoidance of trigger factors of heartburn, intake of meal should be at least 2 to 3 hours before going to bed. Overeating should be avoided. Small and frequent meals should be preferred. Slow eating of food should be preferred. Acidity treatments generally include medications with antacid H2 blockers and proton pump inhibitors. Though immediate relief may be provided through these medicines, there are side effects that have been observed with their chronic use. Some of the proven side effects are bone fracture, renal failure, heart attack, dementia, and vitamin deficiency. The recovery period in case of acidity depends upon factors such as type of medications, severity of the disease, and dietary intake. It takes more than a week to recover if protein pump inhibitors are taken, otherwise, it may take comparatively less than for H2 blockers. In case erosion occurs as a result of acidity, it takes many weeks to get over the disease, while it can take up to a month if asthma occurs as a consequence. Diet plays an important role as it can speed up recovery. The results of treatment may not be permanent, while medications help in promote prompt relief from the symptoms. Lifestyle changes and avoidance of triggering factors help to achieve a permanent cure. In few cases, the symptoms may persist in spite of all efforts aimed at the treatment of acidity. There are some natural ways to reduce acidity, like almonds, which neutralizes the stomach juice, relieves the pain, and prevents acidity entirely. Munch almonds when you are in a situation of not taking your meals so that it avoids excessive acid secretion. Take 4 almonds after eating. Banana contains antacids naturally that fight against acidity, and intake of a few slices of apple before bedtime helps in relieving heartburn or reflux. While drinking coconut water, the body's pH acidic level turns alkaline and it produces mucus in the stomach. Mucus prevents the stomach from the severe effects of excessive acid production. This fiber rich water supports digestion and prevents the remittance of acidity. You have to have enough sleep. Go for at least 7 hours continuous sleep. Physical exercises are linked to acidity in both positive as well as negative ways. Hence, it is important for us to know how acidity is affected by the exercises that we implement in our daily life. Although doing exercises are beneficial in some ways, high intensity exercises including weightlifting, running, jogging, jump rope, and climbing stairs may aggravate the symptoms following the worsening of the condition. However, slower as well as low intensity exercises which keep one in an upright position and do not involve bending forward should be preferred in such conditions. Some of them include swimming, water aerobics, cardio biking or stationary biking, brisk walking, light weightlifting exercises, and yoga. These physical exercises should not be performed vigorously and must be done with proper precautions regarding the poses. Alternatives to the treatment are acupuncture, relaxation, melatonin, hypnotherapy, herbal remedies, and baking soda. Lifestyle modifications like losing weight, avoiding smoking, wearing loose clothes, sleeping with head end up may aid in relief from acidity. The food that helps reduce acidity are vegetables, ginger, oatmeal, egg whites, non citrus fruits such as melons, bananas, apples, and pears help reduce acid triggers and symptoms. Seafood and lean meat such as turkey, fish, chicken, healthy fats such as walnuts, sesame oil, avocados, sunflower oil, flax seed, and olive oil. This help reduces the saturated fat and replaces them with healthier unsaturated fats. Milk may help buffer the acid in the stomach and absorb the excessive acid produced in the body. It can also help alleviate acidity indications like reflux or heartburn. However, milk should be taken plain and cold with no added sugar. Warm water is great for flushing out toxins from the body and makes food breaking down easier. Additionally, water has a neutral pH which thus helps increase the pH in the stomach and reduce acidity. Drinks that are good acidity are herbal tea, coconut water, low fat or skim milk, fruit juice, plant based milk, water, and smoothies. Coffee does not help with acidity as it stimulates excessive gastric acid production in the body, which may rise up to the esophagus. Coffee thus increases the acidity as well as heightens its symptoms. Along with coffee, it is advised to avoid caffeinated drinks while suffering from acidosis. Curd is really good at controlling acidity. It is a natural antacid and a probiotic. Curd contains good bacteria that has a soothing effect on the stomach, helps acidity, and gives a boost to the immune system. Foods rich in carbonated drinks, red meat, dairy products, citrus fruits, cashew, peanut, legumes, and walnuts, which are high in acidity. So, you must avoid these foods. So, acidity is commonly referred to as acid reflux. It is a condition which is accompanied by the movement of gastric acid back into the esophagus. Occurrence of acidity is quite normal if it happens occasionally, but it's a serious concern if the frequency is high. Antacids, H2 blockers, and proton pump inhibitors are some of the options to treat acidity. Consultation with a doctor is important for an early treatment, otherwise, it may lead to complications such as ulcers, strictures, and inflammation in esophagus. Some of the diet modifications and lifestyle changes play an important role in controlling the condition. So, take care of your stomach, eat healthy foods, and avoid the non vegetarians and carbonated drinks, which may increase the acidity of our stomach and create some problem in digestion. So, that's it for today's video. I hope so you got some scientific fact related about this acidity in stomach. And if you have any science related queries, you can ask about it and get it rectified. We'll meet in the next Science Fact Treasury series. Until then, it's goodbye from Sam. Take care.